Hello, this is U.S. Congressman Alex Mooney. Thank you for joining my live telephone town hall meeting this morning. I'm honored to represent you in Congress. I am calling you live from our Martinsburg district office here in West Virginia. If you're on the line, you're in one of the 17 beautiful counties I'm blessed to represent: Jefferson, Berkeley, Morgan, Hampshire, Hardy, Pendleton, Randolph, Upshur, Lewis, Braxton, Clay, Kanawha, Putnam, Roane, Jackson, Calhoun, and Wirt counties. Those are the counties we're calling today because that's who I represent. We're joined again by Dr. Matthew Simmons. He joined us for our last telephone town hall meeting last week. He's the Infectious Disease Clinic expert in Martinsburg office. We also have on this call on the line, Rick Haney. He's the Lender Relations Specialist for the West Virginia District Office of the U.S. Small Business Administration. He's physically located in Clarksburg, West Virginia, with also a branch office in Charleston. Mr. Haney will speak when I'm done my opening remarks, and then Mr. Simmons, and we'll go right to questions. So thank you, Dr. Simmons and Mr. Haney, for joining us this morning. We would like to hear from you. This is a telephone town hall. We take questions. You may press *3 on your phone at any time if you have a question and would like to get into the question queue. Again, *3 to get into the question queue. If you're just joining, this is U.S. Congressman Alex Mooney joining our live telephone town hall meeting specifically on the coronavirus. That's the purpose of this town hall meeting, to talk about the coronavirus, not all the other issues out there that are important, but today it's about the coronavirus. Thank you for joining me. I'm eager to hear your feedback and give you an update on the coronavirus response by the federal government. On December 31st of 2019, the first cases of coronavirus were reported in Wuhan, China. On January 30th of 2020, the World Health Organization declared a global health emergency amid the spread of the disease. One day later, President Donald Trump restricted travel from China, a swift and decisive action that brought our country some much-needed time and likely saved countless lives. Again, this is U.S. Congressman Alex Mooney. You are currently joining my live telephone town hall meeting. Press *3 at any time to get into the question queue to talk live on the line with me. That's *3. On March 4th of 2020, this year, Congress passed more than $8 billion in emergency funding to initiate the coronavirus response. Money goes to the Department of Health and Human Services, including the Centers for Disease Control, to stock up on medical supplies. Additionally, hundreds of millions of dollars goes to the National Institutes of Health towards research and development of vaccines, treatments, and tests for the virus. This is on top of the already existing funding. This funding also provides state and local governments funds to actively begin their response. You're joining our live telephone town hall. If you're just coming on, *3 to get in the question queue. Over the past couple of weeks, the coronavirus has continued to spread, and the World Health Organization declared a global pandemic. The number of cases and deaths in the United States has continued to rise at a steady rate. As a result, further precautionary measures have become necessary. President Trump announced guidelines in his 15 days to slow the spread plan. In this, the president, with his coronavirus task force, recommends that all individuals work or engage in homeschooling whenever possible, avoid social gatherings, utilize drive-thrus, pickups, or delivery options, avoid discretionary travel, among other guidances. We can all do our part to reduce the risk of spreading the virus in the community. Here at home, West Virginia Governor Jim Justice announced this week a stay-at-home order for West Virginia to further combat the spread of the COVID-19 in West Virginia. This simply directs all residents to limit movements outside of essential needs. The Centers for Disease Control also advise we continue to follow common sense precautions and practice good hygiene. Remember to wash your hands often, scrub with soap and water for 20 seconds, stay home when you are sick, clean and disinfect frequently touched objects and surfaces, and refrain from touching your eyes, nose, and mouth. Evidence available to us at this time suggests that COVID-19 can last for days on some surfaces, such as on plastic and stainless steel. Additionally, those above the age of 60 should stock up on supplies, such as over-the-counter medications and groceries. Nationwide testing equipment is becoming more rapidly available with more rapid results as well. The U.S. Surgeon General just recently advised that if you are experiencing symptoms of the coronavirus, please call your health care provider. That's a phone call. Rather than potentially infecting others by going to the doctor's office or the emergency room, healthcare providers can provide you with the information you need on evaluating testing of the virus. Again, this is U.S. Congressman Alex Mooney, and you're currently joining my live telephone town hall meeting. Please press star 3 to get to the question queue and talk live on the line with me or Dr. Matthew Simmons or Mr. Rick Haney of the Business Administration. Please stay current on healthcare updates from your local county health officials and the Centers for Disease Control at cdc.gov. If you're interested in receiving updates from me about coronavirus, subscribe to my newsletter, mooney.house.gov. That's mooney.house.gov. I will remain in continuous contact with the Trump administration and relevant agencies at the federal and state level about the virus response and continue monitoring the situation to keep you informed of the latest developments. I will continue to fight for the most vulnerable members of our community, including the elderly and those with pre-existing conditions. These coming weeks will be a challenge for West Virginia, but we've faced worse. This is not our first global health crisis we faced. In the last 2 decades, we've seen several global outbreaks, including SARS in 2003, avian in 2008, swine flu in 2010, MERS in 2012, Ebola in 2014, and the Zika virus in 2016. Our country has put a man on the moon and endured many struggles throughout our history. So today we will do the same on this, and we will beat this coronavirus. So let me start. Again, we have 2 guests on the line to make some introductory remarks before we go straight to your questions. Press star 3 at any time to get into the question queue. I guess star 3 at any time to get into the question queue. So first, let's hear from Mr. Rick Haney. Again, Rick Haney is here in West Virginia. He's located in Clarksburg, West Virginia. He's the Lender Relations Specialist for the West Virginia District of the United States Small Business Administration. As a Lender Relations Specialist, Rick is responsible for outreach, training, education, development, recruitment, consultation, and basic overall working with lenders and lending institutions throughout the state. So, Mr. Haney, please go ahead and greet our audience here.
Well, good morning, and thank you, Congressman. Appreciate that. This is an unprecedented and the first time that the SBA's history that we have had the authority to issue a declaration in response to a virus. Our focus at SBA is right now on leveraging all of our resources to process the economic injury disaster loan applications for small businesses and nonprofit organizations as quickly as possible. We don't have the numbers at this time, but as an example, see how quickly SBA is moving, then we can report the first economic injury disaster loans for small businesses began to be approved last week, just 3 days after their applications were submitted. So it's a process. It's a direct SBA loan from the SBA. It's not through the bank. And the parameters of that are you can go up to $2 million on that. The interest rate at this time is 3.75 for businesses, and for nonprofits it is 2.75%. And the term is they're up to 30 years, and the first payment is deferred for 12 months. That's kind of the down information on the economic injury disaster loan. So we can take questions on that and get into further detail as we go forth. Thank you.
Thank you for that. And then Dr. Matthew Simmons, let me introduce him, have him make some opening comments. Dr. Simmons specializes, again, in infectious diseases, which is exactly what this is COVID-19. He's been closely monitoring developments surrounding COVID-19 in West Virginia, and he is located, actually calling us from his laboratory in West Virginia right now. Dr. Simmons, go ahead, please.
Good morning. Thank you. I just wanted to start off by thanking all the citizens of West Virginia for participating and doing their part with social distancing and staying home. I need to encourage you all to continue to do that. And if you do have to travel outside of your home, do so only for urgent things such as buying grocery, getting gas, seeking health care. And if you are going to seek out health care and you're ill, please call the location that you're traveling to in advance to let them know so that they can protect themselves. We really need to continue as a community to minimize the amount of exposure that we're putting out there so that we can keep West Virginians safe and healthy.
Let's go ahead to our first question then. Again, if you're just joining, you're live on the Telephone Townhall meeting with Congressman Alex Mooney, Dr. Simmons, an infectious disease expert, and Rick Haney with the U.S. Small Business Administration for West Virginia. So we're going to go ahead and take our first question, and that is going to be from Jane in Ravenswood. Jane, go ahead.
Hello. I'm 85. I've been staying in. I'm doing everything that I've been told, but my concern is my mail. I live in an apartment building. I pick up my mail every day, and I get it from everywhere. Now, how do I know that there's not germs on my mail? I can't I have to pick up my mail.
I'm going to defer that to Dr. Simmons.
Nobody is related to that, even the president.
It's a good question. Ma'am, it's a good question, and we're not quite sure. We are thinking that this virus could live up to 14 to 17 days on smooth surfaces. What I would suggest is that when you pick up your mail, if you have a pair of gloves, that you use those, and you would open your mail with gloves. The inside of it should be fine. It would be the outside that would be, and if you have a concern, I would open the mail with the gloves on and then immediately throw the envelopes away.
And I don't need to worry about what's inside the envelope, no matter where it came from.
We have not had any transmission of the virus that occurred by mail. I can't tell you that 100% it won't happen, but it is not the main mechanism by which this virus is transmitted, and we've had no documented cases of the mail being a mechanism of transmission.
Okay, well, thank you very much. I appreciate
your answer.
You're welcome. Stay safe. Okay, bye-bye.
As a quick follow-up to that, Dr. Simmons, if someone doesn't have gloves handy, can they use a napkin or a towel or something else? Or
I think any kind of barrier between their skin, or if they open their mail, one of the things I would encourage them, if they don't have a barrier, to do it all at once and wash their hands very well for 20 to 30 seconds afterwards and not touch their face, or eyes, nose, or mouth while they're opening their mail.
All right. And then as a quick follow-up to that, I know I've experienced, I'm at home in West Virginia with my family, and we've had a couple packages delivered, and they hand you the package, and I take the package, and I'm not 6 feet away at the moment I take that package. Should we keep the 6 feet distancing in that case, or is it just a general, what would you advise on that?
Some people are placing signs on their doors saying, please leave the package on the front step.
Right.
And that is one way to do it. The other thing is you could open your door and just ask them, could you set it on there? Most of these things don't need signed for, and if that's the case, then you can certainly have them just leave it on the front desk or front step.
Okay. All right. Thank you. Again, this is Congressman Alex Mooney. You're joining our live telephone town hall meeting. We do have a question specifically about the Small Business Administration from Pastor Christopher Abel. Pastor, go ahead.
Good morning.
Good morning.
The churches were one of the first that were asked to set aside and social distance and close down our doors. For those of us who were not prepared for an online direction, we're being forced to make a lot of jumps technologically. There's some cost involved with those things. And by not having our people coming together, and with everybody's financial situation the way it is right now, we're finding that the people are not making donations as they normally would, which is going to leave the church. We're having extra expenditures, and we're not able to make our current payments there to help offset things. Now, I have a fairly small church, so for us, it is not completely impossible, but I thought I would contact the SBA and get some assistance. I had some difficulty with the online loan for the thing, for the EIDL, so I contacted the SBA via phone, and after spending 3.5 hours on the phone to request assistance, I was informed by the woman that churches and religious organizations are not allowed any assistance during this disaster at all. We are completely blockaded. I'd like to know if that's accurate, and if it is accurate, what is being done to help the churches during this time, because I've got no direction to reach for assistance. Banks want to see your tax returns, and churches don't do them.
Okay, that's a great question. Mr. Haney, do you have an answer to that?
Yes, sir. At the present, under the Economic Injury Disaster Loan, religious organizations are not eligible based on the criteria set forth under this program. We're just following directions that we have received through Congress, passed down through there, and they're setting our statutes and limitations on how we can offer those. So we do have a list of what are eligible and what are not eligible for that. But unfortunately, the church religious organizations are not eligible under the Economic Injury Disaster Loan. And I do know that these are unprecedented times. That SBA system is experiencing an onslaught of calls, an onslaught of the application process. And so we're working as fast as we can go, and they're also trying to get more people on board and working with the SBA in order to handle all the calls and the inquiries. And as we know later on, we may have a different situation where it comes to maybe offering some relief to small businesses and other certain nonprofits through some other things once the current situation through Congress has been passed and run through the President. So that might be another offering which may relieve some stress and pressure that we have right now on the current systems.
Well, Pastor, thank you for bringing that up. I will keep that in mind as we go forward and look into it further. And I know churches and charities are often the first line and certainly value of the services churches provide, and we need to support them any way we can. So thank you for bringing that to my attention. I really do thank you for that. Let's go ahead to another call from here in Martinsburg area. And I think we have Patty on the line. Patty, go ahead.
Yes, hi. My question is, do we have enough chloroquine and azithromycin here in this area if we have a severe outbreak here in West Virginia?
Okay. Dr. Simmons?
Currently, Mylan Pharmaceuticals in Morgantown is ramping up production of hydroxychloroquine. Chloroquine is an older drug, and Plaquenil or hydroxychloroquine is the one that gets better serum concentrations. There are multiple places ramping up production, and hospitals have been undergoing a large buy to find enough supplies of it. We're actively in the process of getting more, so we are preparing for the outcome, and we have been stocking up for about several weeks now.
Can I ask one other question?
Sure.
I know people that have called into the hotline, and they have severe symptoms, and they're not being tested. Are we short on tests?
So right now the CDC has a test prioritization, and it includes frontline personnel, healthcare workers, law enforcement agents, the very elderly, and then there is people with comorbidities. Young, otherwise healthy, fall into another prioritization category. What those people are being told or should be being told is to call back if their symptoms worsen. We're trying to prioritize those who are the sickest currently. Our hope is within a week or two, as we get more testing, that we'll be able to test anybody who calls. But right now, we're really trying to prioritize those who are sickest.
Okay. So we don't have a lot of tests then here in West Virginia.
It's increasing. We are processing just as many tests as we have, but we do not have enough to test every single person at this time. But we are anticipating as more organizations increase. There are 3 more labs that we are approaching to try to get more samples. We're hoping that in the very short future we'll be able to test a significantly larger portion of people.
Oh, thank you. Thank you very much.
So there's a lot of questions about testing, Dr. Simmons, and so I'm maybe asking a couple follow-ups. Again, if you're just joining, this is Congressman Alex Mooney. You're joining our live telephone town hall meeting covering 17 counties across the state of West Virginia that I represent. And we're on with Dr. Matthew Simmons, Infectious Disease Clinic here in West Virginia, and Mr. Rick Haney, who's a lender relations specialist for the West Virginia District Office of the United States Small Business Administration. And if you'd like to ask a question, you may press *3 at any time, now or at any time, to get on the phone and talk live on the line with me or Dr. Simmons or Mr. Haney. Again, star 3 to get into the question queue. This is our telephone town hall meeting. It takes an hour. We're about halfway through already. So just a follow-up, I guess, for Dr. Simmons on the test. I think it's the test change, if I recall, and I'm just seeing, I'm getting briefed via conference call and emails all the time from different government officials as a congressman, but it's my understanding the test time, there's different types of tests or new tests are being invented. It was 4 days, now it's 2 days. There's talk of a test that'll be like an hour. So the medicine behind this is changing very rapidly. Maybe you could talk about that a little bit, because again, we have several questions about can somebody get a test and how does that work?
Sure. I want to encourage people to remember that per the CDC guidelines, these recommendations on what tests are able to be used and how who's available for testing change on a daily basis. So this could be completely different in 2 or 3 days. Currently, most of the tests it's not the problem with how long it takes to do the test any longer. It's just how many people we are testing. West Virginia has markedly increased their testing from none several weeks ago to hundreds of people every day. It's just that with labs, the few labs that were initially doing testing were being inundated by the vast majority of testing. As soon as West Virginia University systems were able to test, we used all available tests. We tested as many people as we could, the highest priority people, and we continue to use every single test that we have at our availability based on that prioritization per the CDC guidelines. It is not so much as how long the test takes, it's more of the fact that we're just now trying to test so many people that the labs can't process them all as quickly as they would like. As things change, more tests are being available. We are looking at every opportunity, including multiple labs, in-house testing, things like that. As more options become available, that turnaround time will diminish and the availability to more patients will increase.
Well, okay, so we got a lot of questions, so I wanted to make one more comment, then take another question. But, a few days ago, I called my primary care doctor because I've been around people that have, other congressmen who've been exposed, and they walked me through several questions, and they said, you're not at risk, you don't have any symptoms, and it's been too long of a period of time since you were in contact. You do not need a test. So I did not get a test. And I think when we talked about this last time, several days ago, 90% or so of people that have been tested came back negative. So I think part of the solution to making sure everyone can get their test completed is also to make sure people who don't need a test because they don't have any symptoms or any reason to get a test aren't requesting them. Would you say that's an accurate statement?
Absolutely. Again, I just want to remind everybody we are prioritizing those who are sick or those who are on the front line who have the highest risk of exposure. For the average American and the average West Virginian, your risk is still much less than healthcare providers, police officers, people in nursing homes, those with chronic conditions. So we're trying to prioritize those tests. Eventually, we will get to a point where testing will be widespread and we'll be testing a lot of asymptomatic people as well to try to curb spread more than likely. But right now, the CDC is really asking us to prioritize those who are sickest and those who are on the front lines.
Okay. All right, let's go ahead and take another question. This time we'll go to Putnam County, and Melissa's on the line. Go ahead, Melissa.
Hi there. My question, we absolutely understand the gravity of the situation and the need for social distancing. That being said, we have a lawn care company, and all of our clients are wanting their yards taken care of. With the order that has gone down with the governor, are we able to continue servicing those yards? Obviously, they're out in the yard, they're not within 6 feet of people. Is that acceptable? We just want some clarification on that, please.
Let me ask Rick. Rick, do you think you can answer that one? Can landscapers mow lawns? Is that within the restrictions of the guidelines? Mr. Haney, are you with us?
Yes, sir. I said I think that would be. I think I know I'm out and about, and I do lawns also myself, and also our outside activities and exercises. And I don't think that would be any problem as long as you're away from everyone. And certainly you're at least 6 feet away when you're out cutting grass. Nobody wants to be around you. So.
Okay. Thank you. Let's go ahead to another one. Again, it's Congressman Alex Mooney, press star 3 at any time to get into the question queue to talk live on the line. Star 3 to get in the question queue. We'll go to Weston, Lewis County, and Leslie's on the line. Go ahead, Leslie.
I thank you for taking my call. I was wondering what we are doing. It sort of dovetails to what a few of the other guests had asked about. I was wondering what we are doing to protect and support and to get extra supplies for our healthcare workers who are on the front lines of this pandemic. You know, we haven't seen anything like this before. You know, it's not like Ebola or H1N1. I mean, those were serious things, but this is, you know, much more infectious and whatnot. And I was just wondering what we are doing for our doctors, nurses, EMT, lab workers, everyone from the ground up to get more masks, the N95 masks, gowns, ventilators, and respirators. I worry because, you know, we're smaller in population, and we were sort of late to the game with getting confirmed cases. And so I was wondering what we were going to do to help our rural healthcare providers. And, you know, they desperately need supplies.
Okay. Dr. Simmons, do you have any information on that? Are enough supplies for the people working in the medical community?
What I would like to say is I can only speak for Berkeley and Jefferson medical centers, but for weeks we have been having daily calls with every distributor. We began increasing our backhold on N95s and other surgical masks and PPE several weeks ago. We were cautiously doing this in early January. We are doing conservation for PPE. We've modified some visitation rules and things like that. Healthcare providers are our number one priority in this as far as making sure that they get PPE. We are aware we've had some great input from the community. Our community has been great about donating N95s and masks. The local colleges, nursing schools have also donated. It's really a testament to what a strong community West Virginia is, that we're all pulling together and really trying to provide the best option for every healthcare provider. We continue to approach every distributor on a daily basis asking for larger shipments and more shipments, and things are continuing to come in. We're okay right now. We're not at any critical level at Berkeley and Jefferson, and we're working with the WV system to help continue to make sure that that supply chain continues to provide us with the PPE we need. I really appreciate your support. It's great to know that the West Virginians are behind healthcare workers.
Thank you. All right, so we have a question about where some of the testing is going on. Let's go to Clay County, and I think is it Barbara from Clay County? Are you with us?
Yes, I am.
Hey, ma'am.
I just like to know if anybody in Clay County has been tested for this virus.
I'll ask Dr. Simmons to address that. Let me say, I'm looking at the statistics as of this morning, and the counties that have positive cases are so far Berkeley, Harrison, Jackson, Jefferson, Kanawha, Marshall, Mercer, Mongolia, Preston, Putnam, Tucker, and Wood. I don't see a positive as Clay County on there, but Dr. Simmons, her question is more, has anyone even been tested? Do we know if anyone's been tested there?
I am not in contact with the Clay County Health Department. What I would suggest, ma'am, if you have a question, that you would call your local health department. There should be a nurse on duty there that can give you some information regarding testing. But I have no knowledge of the testing that's going on in Clay County. I apologize.
Okay. I don't want to guess either, but if the symptoms, they should obviously call their healthcare provider and then go get the test done. But those are the counties that have positive cases. Which counties have been tested but don't have positive cases because the tests came back negative? Because most tests have come back negative. We don't know that for sure. All right, let's go ahead to the next question. Again, thank you for calling into our joining our live telephone town hall meeting. This is Congressman Alex Mooney. Again, I'm with Dr. Matthew Simmons, Infectious Disease Clinic in Martinsburg, West Virginia, and Mr. Rick Haney, Vendor Relations Specialist for the U.S. Small Business in Clarksburg, West Virginia. We also have an office in Charleston, West Virginia. We have Faye from Hedgesville. Go ahead, Faye.
Thank you very much for providing this virtual town hall for us. it would be great if it could be shared, on Facebook or other media with those who couldn't tune in. I do have two questions about the stimulus bill that I understand is going to be passed soon. And the first is, why did the original stimulus bill include trillions of dollars for corporate bailout with that funding under the complete control of the Secretary Treasurer, and with the stipulation that details of corporations receiving the funding would not be revealed until after the election? I think this was a major delay in getting a bill passed, and I'm just trying to understand why that was part of the bill.
Okay. So that I've been keeping up on that because there might be a vote later this week that I've got to go down to D.C. and vote for, possibly even today. And my understanding that sometime around 1:30 this morning, the Senate leaders, Mitch McConnell and Chuck Schumer, announced they had an agreement on terms, but they have not released the bill yet. So to your point about the money going to corporations, I think an amendment was made that there'll be an oversight committee of 5 people appointed by Congress to see where the money goes, so that it can't just be given by the Secretary of the Treasury, which is a concern you just mentioned. And so I think this committee now has to oversee it, according to what I read in the reports, in the briefings. I haven't seen the text of the bill, and there's supposed to be an inspector general to oversee that too. But I think to your point overall, it is a lot of money. The estimates I'm seeing are around $2 trillion, and please note that $2 trillion is more than we spend in an average year on discretionary spending. So in one bill, we're going to spend that. It's almost hard to conceive the amount of $2 trillion. It's a lot of money. Checks going to individuals as well. So it's something I have to review very carefully. We want an economic stimulus. There's a lot of tax cuts in there. It's a lot. There's a lot of tax deductions, tax cuts, interest-free loans being put in there, as well as grants. But what's not been talked about a lot is where the money's going to come from. Someone has to come up with this $2 trillion, and I guess we borrow it. What we've done in the past when we don't have money is we borrow it from other countries. So we already have a large national debt. But this is a time of crisis, and I know people are looking for help with the economy, so we'll have to look at this bill carefully. Let's go ahead to the next caller. And again, Congressman Alex Mooney, thank you for joining our live telephone town hall meeting. And we will go to Irvin in Upshur County. Irvin, go ahead.
Yeah, I was wondering if the Social Security Administration and the banks are still going to be able to get the monies that we're entitled to every month out to us, or are they going to be shut down because of the virus?
Mr. Haney, do you think you can answer that?
I assume none of the banks that in our area are drive-thrus and everything are still open. A lot of the funds that come through Social Security and to paychecks and things of that nature are electronically deposited, so there won't be any concern or anything of that nature. They'll automatically be deposited into the accounts. So, and I do know, we work in the same building as the Social Security Administration. They are not in, however, they are still taking calls. They're not actively seeing individuals face to face, but they are still functional, working at home, taking calls and answering questions in the day of this electronic age. So, I don't think there'll be any concern about getting your funds out when it comes to that.
Okay, thank you.
So, Social Security checks are still going out, and they go straight to the banks and get deposited, right, Mr. Haney?
Yeah, that's correct. Uh-huh.
Yeah, so Social Security checks are still going out. It was also my understanding that banks, and I actually have a call with the West Virginia bankers in most of West Virginia. I'm on the Financial Services Committee, which oversees banking. So I have a call right after this telephone town hall with West Virginia Bankers Association. But it was also my understanding that bank transactions were still allowed, not only remotely, but even in the bank. And so, do you know, Mr. Haney, offhand, can someone still go into their bank branch and make a financial transaction?
I think they're taking, I think they said call ahead, similar thing, the way that I've noticed here, because there are several banks in my area. They're saying some folks are still there, actively there, but most of it's drive-through work, and you just drive through or call them and see if anyone's there, if you have to do any transactions to make an appointment ahead of time. Just not actually go into the bank, but just call ahead of time and someone will meet you there, and if you have to meet someone to do a transaction or something of that nature.
Yeah, most bank branches have drive-through options, or many of them have drive-through options also, which are available. So, Irvin, does that answer your question?
Yes, it does. Thank you.
All right. Thank you. Thank you very much.
Mm-hmm.
So we'll keep going again. Thank you for calling in. I know these are uncertain times. We have lots of questions, so we'll get another question here for Dr. Simmons, and this is from Brian. Go ahead, Brian, if you're on the line.
Thanks a bunch. The virus gets into people through mucous membranes, eyes, nose, and mouth. Can the virus infect directly through a cut or a wound? Say I have a small cut on my hand?
I mean, it's certainly possible. It is much less likely just because of the mechanism of how the immune system functions at a cut versus in the mucous membranes. I would still cover up any cuts that you would have with a Band-Aid just to make sure that you were absolutely safe.
Okay, thanks very much.
Okay, great. So we're going to just keep going through. We've got a little bit more time here for several more questions. Again, if a lot of questions have been asked, but *3 on your phone to get in the question queue at any time. Press *3. So we're going to go to Deborah from Baker. Deborah, go ahead. Deborah, are you with us?
Hello.
Hardy County? Oh, okay. Sorry, we accidentally clicked that one. Call back, Deborah, if you can. Let's go to another question. And it was a question about people coming in from out of state. Let's see, Kermit from Hurricane in Putnam County. Kermit, are you with us?
Yeah, good morning. I have a question. I think I had it in February for 4 weeks. I was on prednisone, antibiotics, you name it, and really didn't get any relief and pressure in my chest till they got me on an inhaler. And my question is there a test after the fact if you think you had it? It was not pneumonia. I had x-rays. It was not the flu. So what was it, and is there a test after the fact?
There is currently not a test. There are some laboratories working on developing an antibody test, but it is currently not in the testing regimen that we're using at this time. It may be available in the near future within a month or so.
Is there a time frame after the fact that the test would be valuable?
We're not certain at that point. Probably at least several months, but don't quote me on that because we've not seen specifics on the tests that are being reviewed right now.
Okay, thank you.
Just a quick follow-up to that, Dr. Simmons. How long after someone's positive are they then negative, no longer contagious?
Currently, Dr. Slimp, who is the state health officer, had said that people after they've been infected should stay home for at least 7 days, and at least 3 of those days have to be without fever. The CDC is pushing a little bit closer to 10 to 14 days. So I would, from onset of feeling badly, it would be at least 14 days before they should be out and about. That is continuing to evolve as time goes on, but right now I would encourage people to stay home at least 10 days.
And I guess another quick follow-up. Again, I watched some shows on this, but I know they're working very hard on finding a cure. Any updates on a cure or something people can take to stop it?
Well, because it's a virus, things are kind of tricky. Viruses are much more difficult to treat than bacteria. Currently, there are some studies being done using, as we've talked about before, Plaquenil, which is an inflammatory kind of medication. Also, azithromycin, which is an antibiotic, seems to have maybe some activity against the inflammation. There's a medicine called remdesivir, which is currently being studied. That had been developed for another virus but is being used in this situation. There's all kind of things that are going on right now, studies that are there's over 40 studies going on right now that we know of with different treatment modalities. Every day we're seeing new information, so we are getting closer. One organization did start vaccine trials the other day in New York, so we are getting closer.
Okay, thank you, Dr. Simmons. Let's go ahead now to I think it's Hampshire County. Dolly in Hampshire County has a very similar question to the technical difficulties next door in Hardy County, the question that we were going to get asked. So, Dolly, if you're with us, go ahead.
Yes. Here in Hampshire County, we're about a 30-minute drive out of Cumberland, Maryland, and only about 3 hours out of Washington, D.C. We have one little grocery store. It's a Food Line, and that grocery store, like everywhere else, is seeing a lot of shortages, and our county has a lot of elderly in it. My question is, in the parking lot, there are a lot of out-of-state tags sitting in our Food Line parking lot. Some of them are D.C. tags. A lot of them are Maryland tags. Is there anything that's been taken into consideration to protect basically the border towns from people coming over and getting the supply of food from the here, taking it back somewhere else?
So I think we should be concerned. I'll let Mr. Haney try that first. And the caller from next door, Hardy County, also had said that she saw a lot of trailers, people just camping out in West Virginia from other states.
Yeah.
And should we be concerned about that as well? So, Mr. Haney, do you want to try that first? Are we seeing a concern about folks coming in from outside of the state to either buy our supplies? I know in Governor Jim Justice's announcement yesterday or the day before that he was ordering the stay-at-home order was intended to get at that issue of folks coming from across state lines into West Virginia to go shopping and use our, buy our supplies. That was one of his concerns, where he initially did not want to do the stay-at-home order. Now he has. So it would occur to me at this point, based on stay-at-home order, people wouldn't be coming in to go camping, for example. But maybe they could. Mr. Haney, do you know anything about that?
Other than what we've learned through the governor's addresses every day, that's one of his concerns. I know that he has probably addressed that to maybe they were saying lock down the borders, as some countries have done. I'm not sure if that'll come to that or not, but that is a concern of the governor, and I do know that that has probably been asked of him on several occasions. So it's something probably the governor has to declare or put in action when that comes to play.
Could I ask a second question?
Sure.
Since West Virginia was the last to have a confirmed case, for whatever reason, be it testing or actually having one, the way it looks like, of course, we're going to be on the back end of the surge. And so we'll be close to the last of reaching the height of the disease when everybody else, hopefully, is on the downside. Is there any plans to transfer supplies, medical PPEs into West Virginia at that time, and maybe then to try to keep the virus from going into other states? We're close to the Virginia line. We have a Walmart about an hour away. To keep it from being reintroduced into the bordering states from us.
Do you want to try that one?
I think that as time goes on, we continue to evolve guidelines on travel restrictions and best practices to keep people at home. You're correct. The projections show us having a later surge than other states. The hope is that we have done good social distancing so that we'll have less, and that the surrounding states that are currently preparing to have a surge, by that time we'll be able to protect people because the virus will have moved through there, and we will have better communications of who's been at risk and who's been infected, and we'll have more testing to help isolate those people who are sicker. One of the benefits, unfortunately, that we have of being later in the surge is that everybody else has already had to deal with these hard times and have got some restrictions in place. I think that those states are working to make sure that they're not importing cases back in. West Virginia is doing the same thing.
Go ahead, Mr. Haney. Were you going to say something? So this is, even for me as a member of Congress, it's very unusual to see some of the things I see happening. Florida, for example, has folks from New York or maybe just New York City, when they come to Florida, have to be quarantined for 14 days, the governor announced. So we're seeing some actions like that. And I guess probably an abundance of caution, but to take the cautions that New York right now, and New York City in particular, from what I've read, is got as many cases as the rest of the country combined. So they're saying if you're coming from New York, that's a problem. Other areas, there's less of a risk. I guess there's not a zero risk anywhere because you just never know. And it's not so much a state border. In my opinion, it wouldn't be a state border that's the issue. It's just what area are you coming from in general and what's your exposure risk. So that would be the thought. But as far as camping out, I do know the governor closed the playgrounds. I have a 5-year-old baby, and we keep her inside because if she sees a playground, she's going to want to go there. Close the playgrounds, but I don't think they closed the parks. You're still not only allowed, but I think even encouraged to go out and get some exercise, ride your bike. Here it says right here at the stay-at-home order I'm reading that you can take a walk, ride your bike, hike, jog, and be in the nature for exercise. Just keep 6 feet between you and others. So if someone's out there camping, I don't know, that looks like a gray area to me. If they're out there camping, they're just camping out 6 feet from everybody. I guess maybe they're out hiking and biking and jogging. It would seem to fit within the guidelines as long as they stay away from people, so they're not spreading the disease. But we have several more questions we'll try to get to here in this hour. And again, we appreciate you calling in here on this live telephone town hall with me, Congressman Alex Mooney, Mr. Rick Haney from the West Virginia Small Business Administration, and Dr. Matthew Simmons of the Infectious Disease Clinic in Martinsburg. And this next question looks like another medical question, so I'm going to ask probably Dr. Simmons, but we have John from Hampshire County. John, go ahead.
All right, specifically, what symptoms? I'm 90 years old, so specifically, which symptoms should I be more concerned about? If I don't have a temperature, does that eliminate the possibility? And I have the symptoms of a cold and a sinus problem, so should I be concerned about those symptoms?
Currently, sinus congestion doesn't seem to be a big symptom, and certainly 86% of people 83 to 86% of people have a fever at some point during their course with COVID. If you don't have a fever and it's mostly sinus, it would sound less concerning for COVID-19, but there is a spectrum of illness, and if your symptoms worsen, the things you should be worried about are dizziness, shortness of breath, and chest pain. Those should prompt you to call your care provider for further evaluation.
Thank you.
You're welcome.
Thank you, John, for that question. We have about maybe 10 minutes left, so I'm going to start to interject a couple questions before we take another call. One questioner asks if we have enough ventilators. Dr. Simmons, do you know if West Virginia has enough ventilators?
We don't know how many is enough based on how badly this will get. We are currently increasing our numbers right now in the Eastern Panhandle. We do have enough ventilators for the people that need them at this point. If we get an enormous surge, there's no way to tell. It's certainly a problem in other places of the country currently, but the Strategic National Stockpile is also starting to release some. And to my knowledge, the president did give the go-ahead for certain companies to start making more ventilators. So we are becoming better prepared with every day.
Okay. And I also read there's some additional testings and treatments that if they come through, like this 1 hour testing, you might be able to reduce the need for a ventilator. I don't know if that's something you can comment on, Dr. Simmons.
It looks like some of these medications certainly are decreasing the duration of time that people need ventilators, so it would certainly be beneficial, yes.
Thank you. Now we have a question for Mr. Haney related to business again, and this is Bill in Jefferson County. Bill, go ahead.
I have a question for Rick. The SBA said that there's going to be loans available. And Alex mentioned that the bill has a mechanism to turn that loan into a grant. What is the criteria for a loan to be turned into a grant?
At this point in time, we're still waiting direction on that. I know there's been discussion back and forth on that. Speculation is, from some of the calls that I've been on and paying attention to, as if the monies were used to cover payroll in order to keep individuals working on the payroll. That one might be considered, looked at as not a grant, but forgiveness of that portion of the debt. Then again, these can change. I mean, these programs will probably change within the next 2 or 3 days, several different times. But as of right now, there are no grants available, but there has been discussion of if some of the funds were used in order to keep your individuals working and keeping them paying, keeping them off unemployment, and keeping them on your payroll, that might be looked at as probably favorable as maybe possibly being forgiven.
Okay, we have several more questions. I'm going to try to roll through them quickly as we have a few minutes left. Another question about SBA for Mr. Haney and Julie from Inwood. Julie, you're on.
Yes, good morning. Thank you for taking my call. From a landlord perspective, and we want to be sensitive to our tenants' needs at this time. Is there any measures in place for the banks to work with us at paying our mortgages?
Through the SBA loans, I know the landlords are eligible for, if you're having rent, because you're a small business owner, and those are eligible under the Economic Injury Disaster Loan Program, and those will probably be incorporated into the loans that the banks will probably eventually be making. It'll be one or the other. You can't have both, economic injury loan or an SBA 7A loan. Both of them will be kind of geared toward the same recipients, but the same guidelines and things of that nature. So, but I do know that it might be a little quicker going through banks once they get there, but it'll be a week or two probably before the parameters are released onto that. But yes, landlords would be able to, if they can prove that show that they've been affected by the COVID-19 virus.
Thank you very much, Betty.
Thank you.
Yes, it does. So we wait. Hopefully, thank you. Bye.
Julie, thank you for taking care of your tenants and being a good landlord. That's what we need in these times. We need people to take care of people. We're all in this together. Let's go ahead. Another medical question about symptoms. I think it's important for folks to know what's going on with the symptoms. So I know some of these questions have different takes on it. So it's Randolph County. Joda from Randolph County. If you're on, go ahead, please.
Hi, this is Jutta. Thank you for the meeting and caring. The symptoms, are they given sore throat too and trouble with the lungs? Breathing very hard. And I want
sore throat,
to use that out.
wheezing, trouble with the lungs.
Yes, those are symptoms of COVID-19 infection as well.
Our postmaster told us for our protection, the mail is sprayed with Lysol, and I was very glad to hear that.
That may be something that the postman is doing. I'm not sure what the Postal Service is doing to mitigate risk, but it's certainly not a bad idea for those people who have it as an option.
This is all I want to know. Thank you.
Thank you. Again, we've got a few minutes left, and we really appreciate Dr. Simmons. I know you're extremely busy at this time, and the information you've helped West Virginians has been excellent. And Mr. Haney, we have a lot more questions now about business effect, how this is affecting small businesses, large businesses, all businesses, because now that it's been a few weeks and we've had these shutdown orders, businesses are obviously struggling. So we're going to go to Morgan County, and Stacy in Morgan County has, I think, a business-related question. Stacy, go ahead.
Yes, hi, good morning. My question is, small businesses, we run small businesses in Berkeley Springs. Everybody is a mom and pop here. It's greatly affecting a friend of mine who has a small coffee shop. She works alone or with one other person, and these small business loans that they've been talking about seem to be geared towards businesses with 50 or more employees. What we need to know is what happens to the small mom and pops who don't have a large payroll, or is there going to be any help and loan forgiveness? Because somebody with 50 or more employees, that means they get pretty swift business, but a small mom and pop, it's just, that's their daily bread, and then a lot of them live, week to week or just above that at times. What's going to be available for them? Paying back a loan is obviously not going to be a good idea or a good thing for them. That's going to be very hard for them to pay back. Is there going to be anything put in place either on the federal or the local level, state level, to look out for these smaller businesses?
Well, they are eligible under our disaster loan program, and will be eligible. A small business is anywhere from 1 to 500 employees, so they are eligible to apply for relief for the economic injury disaster loan, and the interest would be small on that. Plus, the payback term is 30 years, maximum 30 years, so it would be whatever, and it's based on their losses at this extended period of time. We're told that they'll look at their historicals, what they have done the past year or two, what their current liabilities may be, and that will be taken into consideration. And the loan at this point in time will be up to 6 months to cover 6 months of expenses, payroll, whatever you need to keep your business up and running. That would be, the monies would be coming to that. It would be up, the maximum through the program would be up to $2 million. But for mom and pop, they may not need $2 million. They may need $10,000 to cover them for 6 months. And that and the folks that do the processing are they know what exactly they would need based on the information received from the small business. So all small businesses are eligible.
So this is a federal level program. Okay.
That is correct.
All right. Thank you, gentlemen. Stay safe.
Thank you.
Thank you. Thank you, Stacy from Morgan County. You are our final question of this telephone town hall. I'm just going to make some closing comments, but thank you again very much, Dr. Matthew Simmons from the Infectious Disease Clinic in Martinsburg, for your expertise and your good work for us West Virginians you've been doing every day since this outbreak, and even before, and I know you will after. And Mr. Rick Haney, the Lender Relations Specialist in Clarksburg, West Virginia, that also has a branch in Charleston, for the West Virginia District Office of the U.S. Small Business Administration. Thank you so much for joining us. You can hang up now if you'd like. I'm going to make my closing comments. If I did not get to answer your question, you can visit Mooney, Mooney, mooney.house.gov to send me a message, or call my Charleston office, 304-925-5964. That's 925-5964. To conclude, this virus is quite serious. There are some common sense precautions we can all take. I really appreciate the questions about the mail, wearing gloves if you can. Obviously, after you get the mail or you come near anyone, you go wash your hands. I wash my hands 20 times a day, scrub with soap and water for at least 20 seconds. Stay home if you're sick. Clean and disinfect frequently touched objects and surfaces, and refrain from touching your eyes, nose, and mouth. If you do have it on your hands, it gets into your body through the eyes, nose, and mouth. The West Virginia Department of Health and Human Resources has set up an information hotline for coronavirus concerns. That number is 1-800-887-4304. Again, the coronavirus hotline number, 1-800-887-4304. Do not hesitate to reach out to them with any concerns or questions you may have. You can stay current on health updates from your local health officials and the Centers for Disease Control at cdc.gov. CDC, Center for Disease Control.gov. If you're interested in receiving updates from me about the coronavirus, again, you can subscribe to my newsletter at Mooney, mooney.house.gov. We'll do what we can to fight this epidemic and protect you and your family, get through this tough time. Again, if you have questions, if you need assistance on this or any other issue, my Martinsburg headquarters office phone number is 304-925-5964. If you're in the Eastern Panhandle, the Martinsburg office number is 304-264-8810. 264-8810. We still have staff working remotely, ready to assist you. Thank you again for joining this discussion. Today is Coronavirus Prayer Day, so please pray for this virus to end quickly and be safe. God bless.